Hey guys, Preston here, just wrapping up another day on the road at work. For those of you who know my story, you've already heard this, but for those of you who I haven't met yet, my name is Preston. I was a licensed physical therapist for about 10 years. I'm still licensed. I just don't practice PT any longer. I recently transitioned to a medical device sales role. And I love it so far, and I've really just been trying to share my journey with other people that are interested in it, because I know that when I was looking into an option like this, I really just didn't see much info out there, and any of the info that I did come across, it was much more geared towards either other salespeople or folks that weren't necessarily in a clinical realm. And so I really thought, making a YouTube channel, coming out with some content that I thought would be really valuable for people, would just help me as well kind of reflect on my process thus far and where I've come from, where I'm at, where I'm trying to go. So I hope this is helpful to anybody listening. But that's a little bit about me, and I try on these videos to just come up with a topic that I think was important to me when I was going through the process, and I think it's still important for those of you that are kind of carving your own path now. So what I thought we would talk about today, there's a lot of different things, a lot of different directions we can go, but I thought about talking today of, what do I think makes a clinical provider in any sort of realm a successful salesperson in the medical industry? Because that's something I really grappled with as I was planning my transition. As I, always thought to myself, man, I could be really good in that type of role. But when I started writing down on paper, I think some of the things that stuck out to me were different when I wrote it down compared to what I just thought of and just came to mind initially when I started thinking of medical device sales. So I think one of the biggest things that sets people apart and where clinical folks have a leg up in medical device is just the idea of being able to relate with those that are in medicine. So I don't care if you're a PT, you're a PA, you're a nurse, respiratory therapist, occupational therapist, speech therapist. I don't think it really matters, because I think at the end of the day, the idea is that you know what the clinical grind is like, and you also have a really good emotional intelligence as it relates to the medical field and within medical settings specifically. So I'll give you an example of that. I was out doing a field ride with someone that I know that did not come from a medical background. They came more from a sales and marketing background. And on this ride, we had stopped by a few different facilities to check in on some physicians, some accounts. And one of the goals that day of the salesperson that I was with was going to be to talk with a physician about a product that was in our bag. And as soon as we got to this facility, I realized right away that this was not going to be a good meeting, and it had nothing to do with us, and a lot of us know this, that there's a lot of things that happen during the day that can derail a day in either a provider's office or in a hospital setting. So this provider was having a bad day, and a lot of it was due to new staff at the facility that was having a hard time turning over patients. He was running behind an hour on procedures. And I put myself in that moment, I put myself in the situation of my colleague that I was with. And I asked myself, had this happened to me, would I go in and start, discussing this product or this situation with this physician? And immediately it was apparent to me that the answer was no, right? This was not the time and the place for this. It wouldn't be worth the relationship that I've built with that physician thus far. So I decided, no, that's not something I would be doing. Well, the salesperson I was with did not take that same approach, as you can imagine, and not saying it's right or wrong, but she went ahead and continued to go on, her path of discussing this product with a physician, and it totally bit us, in the backside. And the physician essentially, scoffed and got really upset, asked if, we understood that he was behind for the day and all these different things, and if we, acknowledged what he was going through and the stress he was under that day, and it turned into a terrible situation. And I bring this up because what I found, in the sales world in general, if I just lumped it into sales, is that, one of the things I was told throughout this process is, you can't be afraid of asking for the sale. You can't be afraid of asking for the sale. And what they mean by that is, anyone can talk a good game about a product, but at the end of the day, you can have all the clinical data, you can have a good rapport with the physician or so whoever the decision maker is, but are you going to ask for the business? And I think that's a really important topic, because a lot of us think we will, but if we don't want to take that last step forward, then nothing comes of that interaction, right? So I understand the question I was asked a lot, right, of are you going to ask for the business? Are you going to ask for the business? But I think the flip side of that probably doesn't get talked about enough is that there's something at the other end of the spectrum, right, that I think is just as powerful, and that is knowing when to shut the hell up and not to focus on your goals in that moment, and being able to better read the room as to whether I should proceed not with addressing this product or whatever it may be with the physician, but whether I should do it right now. And I think that's a skill, and I will, the hill I will die on is that most folks that have practiced in medicine in some capacity, we are going to have a better idea of that than a lot of other people. And I think the reason is because it comes back in a sense, in a weird way, of just to empathy and having that social awareness that as much as we want to, we will never fully remove ourselves from being a clinician, right? So if I'm there and I see that provider, that PA, whoever it is, struggling that day, it in no means, by no means does that mean that I'm not going to discuss a product with that person at some point, but I'm definitely going to think a lot harder about when I do that. And I'm definitely probably going to be more apt to change my approach if I were to go about it that day to talk with them, because I know what it's like to be in that situation, right? I know what it was like to be at that PT clinic when I had 2 patients waiting for me because one came early and one came late. I had another patient I was treating on the table, and then walks in the DonJoy rep wanting to show me a knee brace for osteoarthritis, right? I know what that's like. And the last thing I would ever want in that moment was for him to say anything to me in regards to his product. If he wants to have a little quick conversation about, something off the cuff, that's fine. But the last thing I want that day is to be pitched on anything. So I think us having those experiences, under our belt, I think that's a really powerful thing, because what I've seen with my own 2 eyes, and again, this is not right or wrong, this is just what I have seen and my viewpoint on it, is that I think natural salespeople have a tendency of pushing, maybe not too far, but more than should be done in some situations. Sometimes it works out well. And there are some predatory sellers that the way they handle all their business is they go in guns blazing with whoever they meet at any point in time. That's not my style, but I think as a clinician, that's a quality that we have of we've been in those moments and we can relate much better with those healthcare providers than I think others can, and we need to harness that, because I think the better you can harness that, as as someone with a previous position in healthcare, the more you are going to be viewed as an asset and a consultant than a salesman. I never go into my job on any day thinking that I'm going to sell a product. I might be selling an idea, and I might be trying to sell a different way of going about a workup or the way of managing a patient, but I'm not selling a product until that physician or that decision maker has bought in on the bigger picture, and the bigger picture is the why, right? So I think if you can have that better understanding and that ability to relate with healthcare providers in general, man, you are just set up for so much more success than other folks. And I think they miss that boat a lot of the time. I don't think they see that they aren't doing, maybe going about it in the best way possible. So I hope that was helpful. I'm getting to a stop now, so I got to cut the video a little short, but I think my long and short of you for today is just harness that ability to be able to emphasize with providers, lean on your previous background of working in the healthcare field and knowing when to talk and when to address people and when not to. you know, I think that's just as powerful, is not necessarily when you talk to people, but when you don't, because that's going to set you apart from the rest, and it's going to make you look a lot different than that next quote unquote rep, you know, that salesperson that walks in the door. And I think you're going to benefit tenfold from that if you're playing the long game. So hope that was helpful. If you have any comments on this, I'd love to hear about them. So, you know, you can always email me, respond to the, you know, put a reply in on the YouTube video if you're listening on YouTube. But just get a hold of me. I'd love to know what your thoughts are, and if you have any questions about any of this stuff. All right. Thanks, everybody. Have a great day.